Hi, I'm Holly. I'll be your nurse today. I'm going to get your IV started first. Do you have a preference what arm we use at all? Okay, so I'll just take a peek here to see what arm might be the best option. So I'm going to get a warm towel, we'll wrap that arm up before we get started, and that kind of helps the veins come out a bit more, and then we'll see what we got. So I'm Holly, I'm a registered nurse, and I work in the cancer clinic at Brant Hospital. I've been nursing for about 4 years now, and been down in the cancer clinic for about a year. Teamwork is extremely important because we're kind of a smaller clinic. We all work really well together, not just the nurses in the chemo room, but the nurses, the primary care nurses, our unit clerks, our doctors, we all work really well together and as a team. In our chemo room, it's all kind of open, so we do have zones that we stick to, but when we go for breaks or if you're kind of busy within a patient starting IV or if the treatment's a bit more complicated, we always cover for each other, do IV pumps. If patients have questions, we try to answer them no matter if they're in our zone or not. And we also always talk to the primary care. If there's questions we can't answer, we go kind of talk to the doctors, primary care nurses, so we can educate our patients the best we can.
Hello, my name's Danielle. I'm going to be your nurse today.
Hi, I'm Eden. I am an RN for about almost 9 years, and I work in the Merge.
Hi, I'm Danielle. I'm an RN. I work in Emerge, and I've been nursing for 4 years.
Hi, I'm Sam. I work in the Emerge department, and I've been a nurse for 4 years.
Hi, I'm Carly. I'm an RPN. I've been a nurse for a year and I work here in the Emerge.
The more calm a patient is, the easier it is to obtain a history. And for us, the most important part of our job is an accurate patient history and knowing exactly why a patient's coming in. It makes the assessment a lot faster, which increases the speed of our treatment method.
Hi, my name is Sarah. I'm an RN, and I've been working at Joseph Brant for 10 years, nursing for 13 years, and I work on acute medicine. The patients drive me every day. I love the feeling of satisfaction, knowing that I am involved in their care and that I am helping them to get better into their journey, to get back home or wherever they need to go.
Hi, I'm Claudine. I'm a registered nurse. I work in the operating room, and I've been a nurse for 24 years. Usually when we check in the patient, you can get a sense of how nervous or comfortable they are with being with you. So oftentimes we diffuse the situation with distraction, whether it's about weather or holidays or food or even just the surroundings.
My name's Stephanie Ludwig. I work here on maternal child and also in the special care nursery. I've been a nurse for about 5 years now and have been at Joseph Brant for the full 5 years. Being a nurse in this department is, I think, one of the best places you can be. It's certainly a happy place, and it's just nice to share these moments with the parents and the babies.
Good afternoon. My name is Carol. I'm a registered nurse in the ICU. I'd just like to settle you into your room, put some lines and equipment on, and maybe an oxygen mask to help with your breathing.
Hi, my name's Christie. I work in the intensive care unit at Joseph Brant. I'm a registered nurse and I've been working there for 10 years. You have to know your patient, every ounce of them, head to toe, and that goes down to the physiological level of understanding what lab results mean and how that can influence your care of your patient and what could potentially happen to your patient. And so that's one of the reasons why I chose ICU.
We've talked about your medications, their names, the doses of the medications, and their side effects. I'm really proud of you today for taking the information, the written information that I've given you, and you have learned what those medications are and become very familiar with them. My name is Joan McCarran. I'm a registered nurse in the medication clinic here at Joseph Brant Community Health Center. I work in the outpatient department. I support several psychiatrists in the medication clinic, and I have been a nurse for over 43 years. What makes it successful for me is when I know that the patients understand the diagnosis, how it's working, what mental illness, the symptoms of their illness is doing, and that there are medications to treat that and to target those symptoms to make them settle and be able to function in society.
Nurses are the heart and soul of Joseph Brant Hospital. They take care of our patients, they advocate for our patients, they keep us informed as to what we need to do and how we need to help our patients, and they help the family, they help keep the patients comfortable. Without them, Joseph Brant wouldn't really be a hospital.
I'm Cheryl Williams, VP for Patient Care Services and Chief Nursing Executive, and I've been a nurse for over 20 years. Thank you to our incredible nurses for the work you do every day caring for our patients and their families. We are so grateful for your commitment to our hospital.